Stroke and Alzheimer's are disastrous major diseases that completely change the life of patients and their families. In patients with stroke, blood vessels in the brain rupture or are occluded. This can lead to the death of brain cells. In patients with Alzheimer's disease, a massive death of brain cells has already occurred. These diseases often occur together, but what causes them? On one hand, it could be the patient's own genes. On the other hand, risk factors for vascular disease such as smoking, high blood pressure, high sugar levels and high body fat also play a role. So we know some of the causes and risk factors, but unfortunately, we still know very little about the prevention of Alzheimer's in a patient with stroke. The EU-funded research project CoSTREAM aims to change this by bringing together a diverse group of scientists studying genes, lifestyle, medical history, and images of the brain to understand the co-occurrence of stroke and Alzheimer's. CoSTREAM has built a unique miniature model of the brain which can be used to validate our findings and develop new drugs and lifestyle interventions. We are studying genes and molecules found in our research in relation to images of the brain and are analysing their effects in the brain model. We have found a series of genes which together make a person vulnerable to both diseases. We have also been able to identify several molecules in the blood that increase the risk of dementia, such as glycated proteins, and others that decrease the risk, such as good fats we obtain from eating fish and certain vitamins. We also found that loneliness increases the risk of dementia. On the other hand, physical and social activities are mitigating factors that reduce the risk of dementia. Additionally, we have found that medication to lower blood pressure and cholesterol levels reduces not only the risk of new strokes, but also Alzheimer's disease. We're now working on translating our findings into a comprehensive computer program that helps doctors and the general public to determine the risk of these diseases and how to prevent them. If you want to know more about the project, visit the CoSTREAM website.